Hey everybody, and welcome back to Mondays with me, Dr. Crystal. So if you look back at some of my earlier videos from about 6 or 7 months ago, you will see there are a couple videos where I answer some medical questions from Twitter. And so it's been a minute since I've done that, so I went back and looked up some more questions, and we are going to answer them today. All right, let's see what we got. If I don't want kids, is my uterus a vestigial organ? So I get why you would say that, but no. So the basic definition of vestigial is something that becomes functionless over time through evolution. Since your uterus is technically still functional, though useless to you, except to give you periods, which is annoying, not vestigial. Can mild water on the knee be treated at home? Will it go away naturally? Or do I have to wait until I can pretend I'm a super athlete, wait until it's actually noteworthy, and get it drained? So in sports medicine, we deal with a lot of knee swelling. Eventually, most swelling will go away on its own. Whether it comes back depends why it's there in the first place. And so a lot of people who have arthritis, they will continue to have swelling and then it'll go away when they rest or take anti-inflammatories and it'll keep coming back. If there's significant swelling and it's causing a lot of discomfort, a lot of times we will draw it off and it'll help the patient feel better. But we don't always do that depending on, like I said, the amount of swelling and how much discomfort it seems to be causing. If we're going to do a steroid injection or something into the knee and there's fluid in there, then we will pull it off first. Other things that can make the knee swell significantly are acute injuries to the knee, like if somebody tears their ACL, it's going to blow up like a balloon. Eventually, even that will go down, but it will take a little bit of time. And so I guess the answer to the question is yes. If you rest it, leave it alone, do some anti-inflammatories, more than likely that swelling is going to go down, but it might come back depending why it's there. I was born in 1975 and got all my vaccinations on time, but with the current outbreak of measles, do you recommend people get revaccinated? So this is a great question. A lot of times people do get vaccinated when they're young and then subsequently lose immunity as time goes on. So the only way to tell if you're immune to something like measles now is for you to get your titers drawn. And so you can ask your doctor to order this, and basically what it checks is the level of antibodies that you have to the measles virus. So we can tell from that lab test if your antibodies are high enough to make you immune to measles. If they're not high enough, you get revaccinated, and that's that. Love that question because vaccines are definitely a hot topic right now. I need a doctor, that's me, to explain why I can feel fine one second and then feel like crap the next. Man, I hate postnasal drip. Any suggestions? So there are a lot of things that can cause postnasal drip. Nasal polyps, the common cold, sinus infections, but by far the most common cause I see is seasonal allergies. Usually if someone is struggling with postnasal drip, I will recommend trying Flonase, which is now over the counter. It's a nasal steroid spray. It actually changed my life because I have really bad allergies, and so when my allergies are bad, I do use Flonase daily. So basically what it does is it decreases all the inflammation back in here. Subsequently, there is less junk available back there to go down the back of your throat. So I usually recommend Flonase, but if you have not been diagnosed yet, please see your doctor to make sure that is what's going on. Woke up with a splitting headache. What should I do? Is it safe to take a leave early in the morning? So the time of day doesn't really matter for a leave. What matters is that you have something on your stomach. So the generic form of a leave is naproxen, which is an NSAID, and NSAIDs can be hard on your stomach. So when you take an NSAID, we always recommend that you take it with food, even if it's with a little snack. So if it's super early in the morning, that doesn't necessarily matter to me, as long as you're going to eat a little something before you take the medication. If you have to take something for a headache on an empty stomach, I would recommend Tylenol. Tylenol is not an NSAID, so it's not going to do the same things to your stomach that a leave would, and so I'm okay with you taking that on an empty stomach. Since when do sprains involve broken bones? They don't. So a sprain is the stretching or tearing of a ligament. A ligament is that fibrous tissue that connects two bones together. Sometimes if you have a really bad sprain, it'll pull off a tiny piece of bone, and we call that an avulsion fracture. A lot of those are treated just like sprains, but that doesn't mean it was just a sprain. It means it was a sprain and a small avulsion fracture, but we're going to treat it the same as if it were just a sprain. So long story short, a sprain can be associated with a small break in the bone, but it's not the same thing. All right, last one. Anyone know how to help broken ribs? I've had broken ribs before. It hurts. I get it. Unfortunately for broken ribs, a vast majority of the time, we are not going to do anything to them to help them heal faster. If it's like a very displaced fracture, it's in danger of poking your lung or something like that, then maybe there will be surgery, but most of the time it's just kind of wait and let them heal. So some things you can do to help with the pain. If your doctor tells you it's safe for you to take anti-inflammatories, you can try that. You can do Tylenol. The best thing you can do to help with the pain with breathing, because with broken ribs, it hurts every time your lungs expand, is get something to wrap it. And they do have rib wraps that you can Velcro like this, or you can use an ACE wrap. But if you have compression on your ribs here, it'll make it less painful to take deep breaths. And so a lot of times we will do that for patients who come in with broken ribs. All right, guys, that is all I have for you today. I hope you learned a little something. If you have any medical questions for me to answer in a future video, leave them in the comments below. I hope you enjoyed the video today. If you did, please don't forget to like, subscribe if you haven't, and I'll see you next week.